about the zones in the theater. We have the zones in the theater for us to be able to set boundaries between the patients and the workers in the theater. These boundaries we are setting is for control of infection. So we are going to talk about 4 zones in the theater. The first zone is known as the unrestricted zone. It's unrestricted. So unrestricted zone is a zone for the passage of patients, personnel, and equipment into the theater. The passage of patients, personnel, and equipment into the theater. So the areas that are found in zone 1 or the unrestricted zone are the patient reception area. That is, once a patient comes from the ward, you have where the patient will be received. That's the reception area. That is where you will check whether everything that the patient needs for the surgery is what? Ready. You understand it? So it's at the reception area you will ensure that the patient is duly prepared, that the patient consent was obtained. You ensure that the patient knows about both the oral, if it's a patient that is going to have abdominal surgery. It's there that you will find out patient's consent. You keep on allaying patient's anxiety. So the reception area is the first part. Then you also have in the unrestricted zone, that is also where you have the area where the patient relative can stay, wait for their patient, for their brother or sister. Then another place is the changing rooms. All the changing rooms are part of the unrestricted zone. When you come in with your outdoor wear, some people will call it street wear. When you come in with your street wear, you now need to change from that your outdoor wear to the theater wear, to the one we call our scrub, our cap, our mask. You understand? So it is at the unrestricted zone area, that's at the changing room, that you'll be able to change now and wear your scrub. Then another area in the unrestricted zone is the administrative offices. All the offices, they are part of the unrestricted area. So this is the area where you change from your outdoor wear to your scrub. You understand it? Once you change now, you can be able to access the zone 2. That's the semi-restricted. That time you are wearing your scrub, you are wearing your footwear, you have changed your footwear, your cap, and your mask. You can now access the semi-restricted. So the semi-restricted zone, it can also be called the sterile zone. So in many institutions, semi-restricted starts from wherever you see red line. Anywhere you see red line, that means you should not cross over with your outdoor wear. You should change before you cross that red line. So from that red line, the semi-restricted, you now get the corridor that to various suits. That is to the sterile zone or zone 3. That's the restricted zone. So it's the corridor that leads to the restricted zone. It's also the corridor that can lead you to the disposal end. So part of this semi-restricted, you can also get the room where sterile supplies are kept. So it's also part of semi-restricted. Then you now have the restricted zone, the zone 3. I said zone 1, zone 2, and zone 3. Zone 1 is what? Unrestricted zone. Zone 2 is what? Restricted. Zone 3 is what? The restricted or the sterile zone. So inside the restricted zone, you are supposed to be completely attired. Make sure you are wearing your cap, your mask, your scrub, and then you have changed your footwear, your Crocs. So your conduct there is that you must always put your mask on. All these things we are doing is to prevent for infection control. We want to minimize as much as possible microorganisms that are being shed to the environment to prevent surgical site infection. So why you are having all these zones is to make a boundary between the people that are unscrubbed and the people that are scrubbed. So you can't have the patient relative barging into semi-restricted or the restricted zone. That is it. In the restricted zone, that is where the whole procedure now takes place. You make sure that you don't compromise sterility when you are in the restricted zone, you have to maintain a temperature of 21 to 23 degrees. It reduces the growth of microorganisms. When the theater is cold, I said that the temperature is 21 to 23 degrees. So it reduces or inhibits the growth of microorganisms. Thereby, there will be reduction in the surgical site infection, because we don't want our patients to come down with any infection post-operatively. Also remember that the humidity inside has to be 50 to 60%. Then after that, you don't have the disposal zone. After the surgery, everything that was used, all the waste generated, they have even the instruments, even the organ that was after scrubbing the work, they will now have to package it, and it has to go out through the disposal zone. So that is where the zone ends. So hope you understood what I have taught you now.